There's 7 billion people approximately in the world today. I took that off the web this week. I was also reminded at a CMDA conference that there are now through 53 million abortions in the United States. This is a thing that shows the growth of the population, an astounding rate of growth, and more difficult to reach all these people in many ways. This I do to remind myself how big Africa is. You can put the U.S., China, Western Europe, India, and Argentina into the African continent and have room left over. There's over 1 billion people in the African continent in 2012, and Bread of the World tells us a little bit about what's going on. Sub-Saharan Africa, the number of people that are hungry has increased over time, gone from 33 to 38% of the people to 43% of the people. A mere 2% of the world's grain harvest, they say, would be enough to meet the hunger needs. And permanent brain damage related to a lack of protein is one of the most devastating things in the world. And I have a lot of questions about that are too profound for me to go into at this time. The rich 1/5 are incredibly wealthy. The poorest 1/5 are incredibly poor. Those in developing countries control 85% of the income of the world, consume 70% of the energy, use 75% of the metals, and have 85% of the wood. That's an astonishing. You talk about feeling wealthy. Every time I pass by a Starbucks and look at the price of a cup of coffee, I'm embarrassed. I'm embarrassed, particularly when you look at what's the $1 and $2 per year. 1.3 billion people live on less than $1 per day, according to the World Bank. 3 billion live on less than $2 per day. You can't even buy most Starbucks for $2. And I can't imagine a child being satisfied with a cup of Starbucks for his entire nutrition. 34,000 children die every day, and this is an old figure, of hunger and preventable disease. 17 million people die every year from infectious and parasitic diseases that Tom could prevent. This is a grave on the right from Mogadishu. You looked around, you knew approximately what ages they were by the size of a mound of dirt. And you could drive that. We hold a clinic with Samaritan's Purse about 100 yards from there. You could smell the decaying bodies. Infant mortality is 9 times higher in low-income countries than developed countries, and that is true of most of Africa. This is a chalk drawing in Sudan telling you what the kids are growing up to think about. It also tells what the world's growing up thinking about when you think that $815 billion was spent in 1992 on defense and income of 40% of the countries of the world. Now, this is the one that really disturbs me. Those deep religious beliefs, I'm assuming most of those that we're talking to are no more concerned about the assistance and development of the poor than are persons with a little or no religious commitment. That should make us think a lot. This is a little thing I took off, said if there were 100 people on the planet, 21 live in Europe, 57 in Asia, 14 in North and South America, and 8 live in Africa. The number of Asians and Africans are increasing, while the number of Europeans and North Americans are decreasing, yet 50% of the wealth of the world is in the hand of 6% of the world's population. 50% of the wealth of the world is in the hands of Americans. Maybe the Chinese are catching up. This is probably antiquated, and I imagine more money is in the hands of the Chinese today. When you look at the educational status, 70 people out of 100 are unable to read or write. 50 suffer from malnutrition. 35 do not have access to safe drinking water. 80 live in substandard housing, and only 1 has a university education. Is that approximately right today, Tom?
Yeah, that's correct.
Those are astounding, statistics. Today on the radio, about within the hour, I heard that of all those that start university in North America, 40% drop out. Of those from poorer, worse backgrounds, inner city type people, only 11% of them finish university that begin. But my interest, and you would have never caught me thinking this in medical school, I didn't like children because they couldn't talk to you, and you might might have some unusual gifts if you set them in your lap, but my passion became children. Life expectancy, and this speaks for itself. I'm not sure how to get rid of the thing in this bottom. This goes through about 1995, 96, showing that in spite of all the advances in the world, our life expectancy is going down in Africa. The chart in the left lower bottom corners, it shows you Africa infant mortality and under 5 mortality as being much, much worse than the rest of the world. Africa bears 25% of the burden of disease and has 2% of the workforce. This shows you the areas of critical need for medical people, doctors, nurses, and midwives in the world. Now, this is one of my favorite slides. The child in the right upper corner was from Rwanda in 1993, 94. It's from UNICEF, under 5 mortalities. 9 out of the worst 10 are in Africa. 19 out of the worst 20 are in Africa. This is in a world of about 200 countries, and 35 of the worst 40 are in Africa. Now, I lived in Africa for 35 years, so my focus has been Africa.
South Sudan has moved up into 2nd place on that chart.
Oh, hasn't it?
Wow.
Yeah.
I was wondering if that country.
A major frustration in the past, when I first went to Kajabi in about 1977, more children died of measles and pertussis than any surgical problem. Thank God for maternal and child health clinics that have changed those statistics significantly. When we first went there, the average Kikuyu lady that lived in that environment had 8 pregnancies. And my assumption was they anticipated maybe 4 children surviving to adulthood. And the children were their Social Security, they were their maintenance for their old age, they were everything because there was nothing in the social infrastructure. Now, some of you know Harold Adolph. This is a dated figure. He said only half of the Earth's population have no access to health care. Only 1 in 20 women can get a C-section for obstructive labor, and only 15% of the patients with hernias can get a repair, even if they're strangulated. When I first flew into Sudan, sitting to my right was the governor of Bahr el-Ghazal, who was a lawyer, a freedom fighter, and everything. And I said to him facetiously, "What do you do with a woman in your area that needs a C-section?" And he looked at me as if there was didn't have to think about it. He says, "They just die." Henry Nouwen said that I still believe deeply that our few years on this earth are part of a much larger event that stretches out far beyond the boundaries of our birth and death. I think of it as a mission into time, a mission that is exhilarating, mostly because of the one who sent me on this mission is waiting for me to come home and live as the beloved. Now, that's a very philosophical statement, but my perspective on that is that God has put each one of us on a mission to touch the world, not to indulge ourselves in the trivialities that we often find in the place we're sitting. What really important dream has God given you for the rest of your life? This is a man named Robert Evans, a missionary in Europe. It's broad outlook, embracing all of God's objectives, and open-mindedness that believes God can do the impossible. A sanctified adventuresomeness, which is mindful of risk because of the certainty of God's call, the consent to do something new. Now, I think if I look around this room, most every one of you have been in places that have been a little risky, but if you were there representing the King of Kings, you didn't worry as much about the risk. Now, you all know this name, Bob Pierce. Lord, I give you license to interfere in my life and plans at any time, in any way, at any cost to me. And then his most famous statement, let my heart be broken with the things that break the heart of God. Are those accurately quoted? Do you know him, Becky?
No.
How old?
Not personally.
I thought you were old enough to know him. In 1976-78, Millie and I went to the Comoro Islands, 4 little islands. 3 of them had been independent 1 year. We were there for the first anniversary of independence. When independence came, unilateral independence, 30 out of their 36 doctors left. And so I learned a lot of things because I didn't have any alternative. And I learned to operate out of a book, had an intimate glimpse of Muslims, 1.3 billion Muslims in the world today, and anything I couldn't do didn't get done, surgically speaking. I tell people proudly that I was the chief of surgery and I was the chief of obstetrics and gynecology, but the thing I didn't tell them is there were no Indians. I was the only one. We had a 350-bed hospital. The other doctor had 200 beds. I had 150 beds, and that was. So, Lance, we'll take you as an Indian next time.
Okay. Good.
1978, we moved to Kenya. We began experience a new thing. This girl on the left, I've only seen 2 people like it in my life. She had polio. She used the muscles of her arms to move her legs because she didn't have sufficient muscles in her legs. She lived in the place, the star is a place called Lamu. In 1982, I made a casual visit to Kajiado, thinking that I was just going down to look at a hospital for disabled children. The last room I was taking to on the tour was the room on the right, and these children had polio, they had braces on their legs, they had crutches all over the floor, and the dutiful nurse walked us outside and looked me in the eye and said, "Can you help us?" And that was the beginning of my care for disabled children. One of the best things after my wife of my life. And this is my indulgence. I sometimes walk down the corridors of an airport and see some sign I like and take a picture. Time for bigger thinking, and that's what happened in 1982 when I saw that. And these were the drawings I began making in the late 1980s, early 1990s of what I'd like to see done with the work with disabled. Now, about 80% of that has been accomplished, quite unintentionally, but have wound up being accomplished. Now, the thing I have to come back, and if any of you have not worked in Africa, remember this is Africa. Remember this is Africa. Whatever you can do, and I remember Dr. Bill Barnett telling me once at Kajabi, he said, anything you can do here at Kajabi is probably better than can be done in the rest of the country. Now, that's a long time ago, so things have changed. Disabilities, what were disabilities? They were polio first, club feet, burn contractures, cleft lips, rickets, hypospadias, hydrocephalus, spina bifida, perforated anus, omphalocele. This girl is from a creative access nation. She came, I think, 7 hours to see us. It cost her, I think, $100 to travel one way. And she never had any care. Sagala. Postulate. And I used to say this to my well-meaning American specialists. If we were to train 2 orthopedic people per year, finish their training, for 200 years, none would die, old age, a lot of vitamins, none would retire, the population of the country would not grow, still we would not have the ratio of orthopedists to patients that we see in North America. I could say that about obstetricians, I could say that about most everything else. So what it does is a stretching experience, saying, try. You'll make your mistakes, but do your best. This child came in about 15 years ago. He had fallen in the fire. He was about 6 months old. He not only burned off his scalp, he had this, the skull was burned. And I initially thought, well, if we could clean that off a little bit, granulation would grow and put a skin graft. Well, we cleaned it off a little bit, but then it meant taking off the skull, and there was just dura there. And we laid a skin graft right on top, and totally in ignorance. It took. And later, Dr. Lewis Carter reconstructed his skull with a piece of wire mesh and put expanders in, and a wonderful thing. Now, part of my life has been spent at Joytown. Millie looked at this yesterday, and she said, "Dick, how come you didn't put anything about Joytown?" So I went back and put it in. About 25 years ago, Bethany, my daughter, and I went to Joytown, uninvited visit, sat on a bench outside the dining hall and watched the kids walk in. And I said to Bethany, I said, we could help 85% of these kids live a better life. Now we have a work at Joytown, and we probably operated at least 300 to 400 of these kids, off and on. In Joytown, there's this little window. I don't know where the sign came on from, but it heralds out to all these disabled kids, don't stop dreaming. Don't stop dreaming. Now, this tells you a little bit about specialists in Kenya. This is probably from about 2003. Look at the right-hand column. Every obstetrician has 76 times the load of an American obstetrician. General surgeon, only 26 times the load, and so on down. If you're an orthopedist, 128 times the load. It's just to tell you how many of these young men, young women in Africa have such an overwhelming burden that it's hard to even imagine taking care of them. This tells you the distribution of surgeons in various countries. While the average American surgeon is responsible for 7,154 patients, the average Kenyan, which is the best of those listed, is responsible for 101,000 patients. So it tells you, again, the magnitude of load. Tanzania, 110 surgeons. They have over 100 government hospitals. They don't even have one surgeon in each government hospital. New neurosurgeons. Now, my last 10 years of my life was mostly doing shunts and spina bifida. I wasn't very complicated. I just fixed on those two types of these problems and a few others. And this tells you what happens in Africa. Every neurosurgeon in Uganda was responsible for 7.5 million people when the slide was made. In DR Congo, there's one neurosurgeon for the whole country, so he's responsible for 66 million people. In the United States, every neurosurgeon has 85,000 people he's responsible for. Every pediatric neurosurgeon, about 18,000. Now, I don't know if you get the magnitude. There's no neurosurgeon in Burundi, Malawi, or Rwanda. Now, this is what happened to us. In 1997, we did 7 shunts and closed the backs of, I think, 9 kids with spina bifida. In 2011, we did, what does it say there, 834 shunts. And it wasn't with any intention, and it wasn't because we were so good. It was just because nobody was doing it. And in this last year, in the Creative Access Nation we've done 80 shunts. Ben Worth is a professor of pediatric neurosurgery at Harvard now, was in Bali, Uganda. He estimated that there are 45,000 new cases of hydrocephalus in sub-Saharan Africa every year, new cases every year. Now, my guess is that only less than 5,000 ever get new care. Now, let me just warn you, Lance, I could even get you to put in a shunt. It doesn't take a rocket scientist. If you can sew a button on your shirt, we could probably train you.
Okay, I'll get some.
Now, everybody won't agree with this statistic, but between 2004 and 2007, we looked at our shunt patients. Our infection rate was 7%. You know, that's as good as many American institutions. So we were pretty happy with that. Now, these are my kids. These are my kids. The one on the right I knew when she was 3 months old. I closed her back for spina bifida. The one on the left, a few months after, that's Rebecca. Rebecca just graduated from university last May. Rebecca is now working with YWAM down south of Dar es Salaam doing her DTS before working with Dr. Pam Follett, who will speak next week on identifying patients with disability in Tanzania. The middle guy, I still always think to myself, that's Baby John, but you don't call him Baby John anymore. He came in, a pediatric urologist did some operations on him. And this was my celebration just before we left. These were all people that I took care of. I saw Billy last week in Kenya. Billy is a computer guru. He could probably help you, Lance.
He probably could.
The one in the left-hand lower corner is Gladys. Gladys is now 21. She's a nursing student. She also has spina bifida. So, and that's Gladys above her as an infant. This is what's happened to Kijabi in the last few years. 2004 to 2011, our volume of neurosurgery has grown a lot, as well as our other volumes, but I won't bore you with that slide. This is a pie chart that shows that our neurosurgery is about 51% of our total in 2011. Do a lot of urology. Again, most of this is done because there's nobody in the country or a few people in the country doing it. Taking care of disabled kids opens some unusual doors. This is at the coast of Kenya. This is near Lamu. My first visit down there, I needed a translator to talk with this young lady sitting on the stool. who had an infected knee. She was from a people group called the Boni, a group of hunters and gatherers, and she helped lead us out in the Land Rover all over the bush to see other Boni people. Famine in northeastern Kenya opened up new doors for caring and for people, and opened new doors for spiritual ministry. And I think Becky and I met over 1993 when Somalia opened up, and there was just an opportunity of sharing there too. Rwanda, 1994, 800,000 people died in 100 days. And then finally Sudan, 1996, as I say, the governor told me women who needed a C-section, they just die. Big country, big needs. This map is old, obviously. There's two countries there where there was one then. This is, anybody recognize that face in there, behind that mask?
Warren?
Warren
Roper?
Yes, you're right. This was state-of-the-art Louis, Sudan, doing a great job. And this is state-of-the-art Kakuma refugee camp. This is the pediatric ward. This was, I think, the picture I gave to go through Senator Frist a few years ago. And this is the Dadaab refugee camp. Yesterday, the web said there's 406,000 Somalis in Dadaab. Biggest refugee camp in the world. Probably one of the most dangerous ones, too, but tremendous opportunities. So this is one day's picture at the Dadaab refugee camp in 2005. 2012, as I say, there's a 406,000, all types of backgrounds to get there. And patients came with all types of ambulances. This is a child with a hydrocephalus that came by the wheelbarrow ambulance. 1.3 billion Muslims. Pictures behind the barred windows are where I stay when I go to my Creative Access Nation. We went there in 2006. There was a medical school, there were medical needs, and we were told by a pretty good authority at that time that there were no known Christians, either national or expats in that country. There's a question of insecurity. There's questions about patients coming, unknown operating room, unknown people to help. I went up there with a fellow named Mark Newton and Harry Krause. We went up there very ignorantly, just saying very ignorantly. God looks after the ignorant, can't everyone? But the security was not a problem. We got up there and we went into the pediatric ward. I went into the pediatric ward in the afternoon, not knowing if we'd find any patients, and later to know that in all our somewhat secrecy, BBC had announced our coming. BBC had announced our coming. And there were people from all over that country and 4 regions around there. In that country was not one plastic surgeon, not one neurosurgeon, not one, well, maybe a half of orthopedists, but there just was no care. There was no care. Less than 100 doctors. Now there's over 200, thank God, for the medical school. The operating room was barely okay. It only had heat sterilization, and even that made you queasy when you looked at the situation. Medical students came to our aid, one of which I continue to work with to this day, 2 really, which I work with to this day, who are now young doctors. We operated from 8 to 6 in the evening, and Harry and Mark and me a little bit, we talked till 9 o'clock at night. It was a tremendous privilege to be there. The day after we arrived, I was going to say medical students, you know, a good medical student is a good medical student in a bad medical school. A bad medical student is a bad medical student in a good medical school. And today, in today's climate, the industriousness and access to the web are the great equalizers. You can learn a lot. But the day after we arrived, one of the female medical students came and said, I've never met a Christian. Turns out that in that country, a recent publication said only 1 in 15 people in the country have ever even met a Christian. So, you know, the gifts God gives us, in our case, medicine, was the door opener and the relationship builder. I said to one of those students that was there then, who's now a young doctor, about 6 months ago, I said, have you ever dreamed I was leaving for something? And she didn't answer me. And a little bit later, she turned back to me and she said, I looked you up on the web. And I didn't answer her. So teaching medical care and sharing, I've learned that my most capable way of sharing probably is praying for the patients, which they now expect me to do. And so I'm learning to pray theology rather than just pray other ways, in a presence. This is my son Rick, who was up there with me one time. He's an orthopedist, a spine surgeon. The girl down in the left-hand corner is the one I'm praying for. Pray for Decca. Pray for Decca. That God would touch her heart. We're going to right Segal again, and the other's another lady. All types of burns. Some of them suicide, and some of them accidents. The little young lady on the left is Nisa. These are her hands in the upper middle. And Nisa said to me, I just want to be able to feed myself. Feed myself. Matthew 24 says, in the gospel of the kingdom will be preached to the whole world as a testimony to every people group. And then the end will come. We're in the process of bringing back the king. This is the Joshua Project. This shows you where it's needed. My country's in the red area. And there's a lot of other people in the red area. 6,955 unreached people groups. 2.84 billion people amongst those. 41% of the world is unreached. Now, in my longer lifetime, I was going to say brief lifetime, but you know I'm lying. I've had the privilege of working with those unreached people groups above. The Boni are on the coast of Kenya. The Wolof are from Senegal. I had a patient come from Senegal because they could not find care for disabled any closer. The Somalis, the Okiek, a small unreached tribe in Kenya. The Daruma, Comorians, the Mwani from Mozambique, the Didinga from Sudan, and others. But the biggest unreached people group I work with is the disabled. We have another little weapon. It's Mercy and her disciples. Mercy now has trained over 300 disciples who are scattered where the red darts are and new red dots. In 2010, she estimated that between herself and her disciples, she had seen 5,000 people come to a living, vital, new relationship with Jesus Christ. Now, when we added all the people up and added our spiritual budget, we figured it cost us $3.84 per soul that came to the Lord. Don't research that statistic. So children are my weakness. Now, there's a few children in there you might know. Some of them are my own kids and some of my grandkids, but that's it. What about sub-Saharan Africa? All the countries listed there, I think I can easily say, have nearly no care for the disabled and probably 20 to 25 others. The disabled, as they are in Nepal, Cindy, are a door opener. They're desperate. Their parents oftentimes, as are the moms of many of the kids with spina bifida and hydrocephalus, they're hopeless because they have, their husbands abandon them oftentimes. Some of them are single moms. They just don't have any way to turn. And Mercy, her entire method is she goes from bed to bed, sits down, talks to them about her relationship with Jesus Christ. She's not fancy, but she cares. And I would love to see disabled work opened up in every one of these countries to a greater degree. About 2 years ago, President Kibaki, who was then the president of Kenya, came to our hospital. I learned that he was dedicating our operating room. He does not like to climb stairs. Apparently his health doesn't allow it, so they took him to the only ward he didn't have to climb stairs. That's a pediatric ward. And we knew he was coming, so we we set up the beds, and we put the right patients in the bed. We had about 8 patients. We took them around, showed them hydrocephalus and various other disabilities. And on one bed, I said to him, there's no hospital of this kind between Cairo and Cape Town. And I didn't know if he heard me or not. After he walked outside, he said to the hospital director, he said, was that right? It's right, I believe. Once, several years ago, when Dr. Paul Brand was living, I called him. I said, this is when we were getting ready to start Bethany Crippled Children's Center. I said, Dr. Brand, we're thinking about this. We want to train people. We want to take care of disabled. What do you think? He said, there's no hospital like that in Africa. So, now, this is getting towards the end. Are you bored and looking for a cause? Disabled would be a good cause. And Lori, Cindy, we could probably get you into the disabled work very fit. We'll get Lance to go put shunts in, and we'll be all set. Tom, I'm not sure where we're going to fit you in, but you'll fit in. Americans are often involved with materialism, sometimes mediocrity, entertainment, Starbucks, workaholism, and trying to be the best. Who cares if you're the best? I sometimes tell a limited audience, I say, when I went to medical school at Hopkins, as I was introduced by Lance, I probably at best graduated in the lower third of the class. I mean, I was not a very good academic. The other people were really smart, much smarter than I was. About 2 years ago, they wrote me and said, would you like to be an honorary member of the AOA, the Honor Society for Medical School? And I laughed and I said, wouldn't my classmates really find out? And this is another airport sign I took a picture. You never have to start a sentence with, I should have. I wish I'd done that. When they polled 95-year-olds, one of the comments that was frequently made is, I wish I had taken more risks. Joel 2:28 says, it will come about after that I will pour out my spirit on all mankind. Your sons and daughters will prophesy. Your old men will dream dreams. Are we old enough to dream dreams yet, Becky? Old women will dream dreams, too. Your young men will see visions. My focus has been disabled children, the unreached, Muslims, and probably too much time dreaming. What if? We used to play a childhood game. Sometimes you'd lay out and look up at the clouds and make all types of things up in the clouds. What if we'd waited because we did not feel we had the medical skills? Honest to God, we'll never have the medical skills to do what's out there. What if we had waited for the funds to arrive before we began? What if we had claimed that this was somebody else's problem? What if we had waited until it was safe? What if we were unwilling to dream God's dreams and see God's visions? And what if we were satisfied with less than God's very best? I throw that out as a rhetorical bunch of questions. And I think those are the last questions. So, Lance, I got done with all my slides.
You amazed me. Yeah, I honestly, I was dubious that you did a great job. So.
Do we have any questions?
Yeah. Does anybody have any questions at all? Please. I hope it stimulates a lot of questions and thoughts. It sure has made me think a lot.
Can you go back one slide?
Back one slide?
Yes.
I would go back one slide.
Just push the arrow over.
Oh, this one.
Yes, sir. That's it.
It says, what if we had waited because we did not feel we had the medical skills? That one's very true. I have no medical skills whatsoever. And I worked with a handicap both in South Sudan and in West Bank.
Mm-hmm.
And you don't need the skills. You just got to have the network and figure out what the process and how to find the help.
Yeah.
That's community-based rehab.
I mean, yeah, a lot of it really is. It's networking and collaboration and working together and finding the resources. Honestly, that's really why I wanted to start this group here, because I didn't want it just to be education, but I think there's so many other people that have access to resources and finances, and if we pull together and we pray, that's part of it. I think is we're so isolated. And but if we, kind of come together and, like I said, really pray and stimulate each other to, with presentations like this, I mean, it really does. It makes you really think, okay, how can God use me? And He uses very average people to do incredible things. In fact, I mean, that's what He does. He tends to use the weak.
There's a book called Disabled Village Children by Werner that if you go on the web, it's all on the web. If you have the book, if you go back to one of the early pages, it says, you may copy any part of this book that you want to, as long as you don't sell it. Very helpful. I teach you how to build and do things that are very practical and can be done in the local situation. And I tell young surgeons, and maybe older surgeons too, if a surgeon can learn how to read, he can learn how to do certain operations. Not all surgeons can read, and that's why there's so many pictures in the book.
Right.
So, when I was in the Air Force, we had little book displays where people were trying to sell things. And one of the Saunders representatives came one day, and I was looking at the books and trying to think of, could I buy a few of them? And the guy looked at me and said, well, what are you going to do after you get out of the Air Force? And I said, we're going to go to Africa. He looked at me and he said, you can have any or all these books for nothing.
Wow.
I wanted to be a medical missionary. He says, I goofed off in university.
Mm-hmm.
And I went with a lot of books I'd have never gone with otherwise.
Mm-hmm.
And I think the other part is, what if we had waited for the funds to arrive before we began?
Mm-hmm.
I mean, that's a step of faith. I mean, don't do it stupidly, but we often said at Bethany Kids, said, we have never turned away a child who needed an operation for lack of money. And we still haven't.
Right.
And I told my wife, she didn't like my theology, but I tell her that if God owns the cattle on 1,000, He'll see me have to sell a few for me. And she looks at me with a real doubt in her face.
Dr. Bransford?
Yes.
You have a question there? That's from Kelly Sides.
The child in a third world country with disabilities might differ in the spirit of the disabled child. See more flight?
Here, I'll read it out loud to everybody. It says, Dr. Bransford, I'm just curious how the spirit of a child in a third world country who has disabilities might differ from the spirit of a disabled child in the U.S. Do you see more fight and drive to live in the third world countries? The children seem to really thrive with just small amounts of love.
I think, Kelly, that I'd also respond to that by saying it depends a lot on the mother, particularly the mother, the father too, but particularly the mother. I mean, we sometimes would get disabled children with spina bifida, and we'd turn to the mother and say, your child will probably never control his urine or his stool. May never walk. And then I would always look for an optimistic thing, and I'd say, but he may be the smartest child in this room. And some of those mothers will carry on. The girl I showed you, Gladys, that's in nursing school, her mother carried on. If Gladys were to sit down with you today and say, up until the age of 15, part of what we teach them is we teach the mothers how to do catheterization of the child in order not to damage the kidneys and not to get residual urine in there. Gladys said, until I was 15, you'd hand me the catheters, I'd walk outside and throw them in the trash can. And she stayed wet, she soiled herself a lot, and, then she realized if she was going to go to school, go further in school, into high school, she had to learn to do that. And she did. She's now my counselor as to what people like this with insecure bladders should do about what they should drink. She tells me what you drink, what you don't drink. And, Rebecca could tell me the same thing, and a dozen other people the same thing. It depends a lot, Kelly, on the mother in the early age, and then their ability to access education or care or encouragement beyond there. We probably have, my guess is, a few thousand children still alive, maybe 1,000 children still alive with spina bifida in Africa. that would have never lived otherwise. Now, we got a lot of training. There were two ladies from Michigan who were physiatrists who came and taught us how to make plastic AFOs for the feet of some of our children, the club feet, how to catheterize children. And I just came back and I carried probably 400 or 500 catheters out for these kids that needed them now.
Anybody else? Other questions? Now's your chance.
Now, we could send out contracts if any of you want to be invited into the rehab community.
Well, Dick, that's what I was going to ask you. What, just to kind of, for people that haven't gone out a lot, or how do we get involved? What do you suggest we do, or what are things we can do?
In Kajabi, in Addis Ababa, and in Mozambique, we could use some specialists to come along. And when I say specialist, I mean pediatric urologist, neurosurgeon, pediatric orthopedist, a variety of other things to come and help them. But also, oftentimes, we could use good nursing to train nurses to take care of these wee little kids. Now, for a long time, we didn't have a pediatrician at Kajabi. Now we've got pediatricians. These pediatricians are training our nursery group. We have a high dependency unit area now that we get better care for our kids. But that's not natural. I mean, our hospital's the only one of its kind, I think.
Yeah. So, and just to put in a plug out there, for World Medical Mission, I always tell people, like, a disaster response is feast or famine, and it's mostly famine. Mm-hmm. So the best way to get ready for that is to, there's so many opportunities everywhere. Becky would love for you all to call, and she's got plenty of assignments, don't you, Becky?
We do. They're on the web, and, again, I've heard this said many times, good experience goes a long way, and you can get short-term experience, and then when something like this opens up, you can plug into there. But again, the exciting thing to me is the Lord gives each one of us differently, and He will give us what we need to use in the future, and we just need to plug into that.
Right, so very good.
And I would not hesitate because you don't know how to do certain things. I mean, I have a friend that's an orthopedist who was scared to death somebody would ask him to do a C-section. I mean, there's more orthopedics to do, and you don't have to do a C-section. But Chuck Miller, who's there, knows that, what he brought to Kajabi was immensely valuable at that time as a pediatrician.
I even did a C-section once.
Oh my God! Well, maybe I have to do one.
I think all pediatricians do that, Chuck.
No, I got caught on that one in Rwanda.
Tanae has a question for you.
Hello, good afternoon. Can you hear me?
Yes.
I'm Tanae from Samaritans First Canada, and I am originally from Nigeria. I was looking through the countries that you put up for disabilities, and I remember being in a class. I studied in the U.S., and I remember being in a class listening to the opportunities that children had in America and North America, children with disabilities, and it broke my heart because I'm from a country where there's nothing like that. And it always makes me wonder about the government and what the government is doing about that. So my question is, what are your thought processes about working with governments or the people in authority that should be doing something about this in the different countries? Because I didn't hear a lot about that in what you said, and so I was just wondering, what are your experiences or your thought process on that?
I think it depends on the government and depends on the people. We've had, when we used to go to Joytown, we would often have the people from one of the training colleges come who are physiotherapists, occupational therapists for further learning. And when they would come, sometimes they said, we want to learn And when it came to polio, the guy who was the professor said, I've taught this for a long time, but I've never seen it. And I think there's lots of place for cooperation. Joytown, the teaching is done by government-appointed teachers. The grounds are owned by the Salvation Army. We provide merely the therapy, the occupational therapy and the physiotherapy, as well as some spiritual teaching. You know, you're from Nigeria. They're probably one of the richest countries in sub-Saharan Africa. And the young girl from Senegal, when World Vision brought her papers to me and said, could we operate on her? I said, there's got to be something closer than Kajabi. And after a year, they said, well, we've looked, either there's civil strife in these countries or there's just nothing there available for them. And they flew her all the way from Senegal to Kajabi. And we teach now, we've got trainees now from Sierra Leone, Uganda, we've had them from Madagascar and Ethiopia, we've had them from Tanzania. We would like to help participate in the training. It's a little hard. When Dr. Stan Topol and I were looking at trying to do something in Kenya together, we visited the Director of Medical Services there, and while we were there, he said, if you'll just give us the money, we'll do the work. And Mrs. Topol, who's a nephrologist, dermatologist, walked out in the parking lot. She's Norwegian. She said, he was very rude. He was, but it depends on the setting that who you can work with. And I think we have a responsibility to work with other governments. In fact, we're getting our materials together for nursing rehab to be able to use them with the nursing schools in Kenya. But my wish is that they go on the web so that there's common teaching out there that can be taught that way.
Thank you, Dr. Brantford.
Thank you. I hope to meet you one day.
I hope so too.
Anybody else?
Hi, can you guys hear me?
Yep. Yeah, sure can.
Hi, this is Jennifer Bussey. I'm a nurse in Charleston, South Carolina, and I was just wondering, you've talked a lot about these children that have kind of chronic medical problems. I guess my question is, what kind of support systems are in place, or organizations that you've worked with, like as far as really empowering the caretakers of these kids? And because I've been in certain countries where children that have disabilities are just kind of pushed to the side, and their caretakers, just because they're kind of shunned because of what's going on. So I was wondering, like, you said that you talked to some of the parents about really focusing on the positive, but what other support systems or organizations are in place to kind of help with that?
When we first started working with disabled kids, we decided that the parents of most of those kids were too poor to come all the way across the country to Kajabi. So we now go to 18 locations throughout the country.
Yes. Jennifer, you need to mute your mic now, please.
But we try and take the care to the patient and to the locality, the pre-op to identify the patients. Most of the parents have taken them to the local clinic, the district hospital, the provincial hospital, and been told there's nothing to do for them. So we go out to the clinic to evaluate them preoperatively. We return usually about every 6 weeks, and if they need an operation, we give them a date and try and get them in. We try not to discourage them if they absolutely need an operation by costs. And sometimes you come back to those people and say, if you can help us later, that's fine. And one day I remember I was at the Nakuru, and I finished seeing the child, and I said, now, here's your appointment to come back. You can go. And the lady looked at me, and she says, I need my chart. And I said, well, I've just given you everything. She says, no, I want to pay my part of my bill. And she walked over, and I think she had 50 shillings, which is about 70 cents, and she paid for it. But we wanted to maintain their dignity but not compromise the child because of their waiting for this.
Amen.
We do also training in clean intermittent catheterization throughout East Africa. Some of our, and I say the big we, our nurses do that. I don't know how to do that. And they go out and teach them how to do bladder evaluations and how they catheterize even a few-day-old infant if they need to. We had a beautiful little girl that had a nice closure of spina bifida, walking all over the place. She was closed somewhere else. And nobody evaluated her bladder. When she came in, her creatinine was very, very high. And she wasn't going to live very long. She could walk all over the place. It was a heartbreaking thing.
All right. Okay. Well, Dr. Bransford, I appreciate that. That certainly, I think, leaves us all with a lot of thoughts and ideas about how, and we should really reflect and ask ourselves, how does God want to use us? And I think you've done a very eloquent job of saying that He can use anybody. Don't wait for finances or until you have a certain medical degree necessarily. God can use you just as you are. That's how He prefers it. So.